Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Welcome to Health for Life. Today we're talking with Dr. Thomas Flynn, a palliative care physician at Hamilton Physician Group Specialty Care in Dalton, Georgia. Dr. Flynn, thank you for being here.
Thank you so much for having me today.
We are very excited to learn more about the important subject of palliative care. And so, many people think that this palliative care is reserved for end-of-life treatment, but that's not true, right?
Absolutely. That's a very common misunderstanding. So here's what palliative care is really about. It's not only for the end of life. It can begin at diagnosis or during treatment. Essentially, it can begin at any time that you are having something with you related to your illness that is keeping you from living your best life. The focus is on living better, not giving up. And the goal is to relieve symptoms. If we can do our job of taking away the things or putting down the things of your symptoms that are keeping you from living your best life, then that is what we are here to do. It's about reducing stress and, most importantly, supporting your quality of life. And I want patients to stay in control and have the feeling that they are the captains of their ship, and all of us in the medical field are there to support and help that process, even when we're facing uncertainty or the great unknown.
What are some of the biggest reasons why somebody would choose palliative care?
Yes, there are several compelling benefits, and I'll list off a few of those. Symptom relief. So we manage pain, shortness of breath, nausea, fatigue, and much more. And these are the things that keep you up at night or keep you from going to the grocery store with your family or making a reservation somewhere with friends. The things that will limit the joys you have in life. Emotional support. We help patients and families deal with anxiety, with fear, with grief, with walking with them hand in hand through an emotionally turbulent time. And a lot of that comes through the third point, improved communication. And that can be clarifying or rediscussing medical information that might have been confusing before talking with another provider or specialist. And being able to take that information and to make it as simple as possible so that we can walk through this and help set realistic goals. I wish every one of my patients was cured of every disease. Unfortunately, I don't believe that medicine has come to a place where we can cure everything. So it's helping to be realistic, but at the same time hopeful with our patients and setting goals that we can work together so that life still moves on and we don't feel crippled or put down or discouraged by what's happening inside of our bodies. And this comes through the fourth point, care coordination, being able to get everybody on the same page. And that is the goal, that is the dream in all of the medical field. But having a team to advocate for you, to talk with a different specialist, to get your medical plan and your treatment synthesized and coordinated across different doctors and different specialties, being able to go above and beyond to coordinate that. And then finally, it's family support, knowing that illness affects not just a patient as a person, but a family as a unit, and being able to provide guidance and respite and comfort to caregivers, knowing that they are just as involved with this process of battling against the disease or the illness that is shortening the life of one of our loved ones. So palliative care looks at the whole person, and it's no agenda, the patient's values, the family's values, and not just the illness.
Who would be a good candidate for this kind of care?
Palliative care is ideal for people that have serious or chronic illnesses. And I'm talking about cancer of any type, especially that has metastasized or grown. Heart disease, if you're feeling short of breath, difficulty doing the things you want to because you can't breathe or you feel out of breath. Lung disease for the same cause, or even advanced neurological conditions, stroke, Parkinson's, ALS. Importantly, you don't have to stop other treatments to receive palliative care. This works in parallel, alongside, as a support to the care you're already receiving. So this could be surgery, chemotherapy, rehabilitation. I like to tell my patients, I'm just an extra layer of support. And when I meet them, I say, how can I best get to know you, and how can I support you, and how can I support you and your doctor?
Wow, yeah. So you can just kind of lift them up a little higher. Mm-hmm. So that's a really good way to put it. And I feel like there's this overarching fear of giving up when it comes to this. And how do you address that with patients?
Yes, that is one of the scariest things that patients and families struggle with and wrestle with, because the focus here is on living. It is not on dying. And how do we help have the best possible day? And there is that, that phrase, we're not giving up. We're fighters. And what makes this phrase so difficult is there's so many emotions underneath. And that is, doctor, please don't be giving up on me. We're not ready to go home to die. It all comes from a place of love. And that is our loved ones caring for us, not wanting to have our time shortened. And this is what breaks my heart when I talk to patients is they say, don't give up on us. And I had a great quote from a mentor of mine. And we do reach the place where we can't have a physical cure. We can't get rid of the cells that are rapidly multiplying. We can't fix the heart or the lungs that's been damaged. But they told me, this is something I truly believe, that even when a physical cure is off the table, there is always room for healing. There's always room for hope. What I mean by that is hope is never lost. Hope can mean many things. It can mean the hope of going to see a grandchild's wedding, or having more time for that. The hope of spending meaningful time with family. The hope of finding purpose and value in a life well lived. So the focus can shift from, okay, we've given every medication, we've given every surgery, every treatment we can. We've reached the place where the body is telling us that it has limited time left. But even then, I tell my patients, there is never abandonment. There is always the possibility of hope and healing. And that can look in many different forms of, restored relationships, beautiful moments spent together, a reflection on a life truly well lived. There are many beautiful things about life and about enhancing life that we can find beauty and meaning in, even when things don't go our ways. So no matter what that diagnosis is.
It's all about hope. Mm-hmm. That's a fantastic and beautiful point to live by, because it can be scary for people. And when somebody is approaching the point of considering this, when should they actually start this care?
Yes, I commonly tell patients, if you have a diagnosis, and with that diagnosis, though, you're experiencing symptoms that are affecting your comfort, they're affecting how you live your daily life, they're affecting how you function, consider palliative care. If you've been given a diagnosis and you have to make decisions based on what your diagnosis is, and you're feeling overwhelmed, you're feeling like the floodwaters are rising and you're treading water or slightly drowning, or you don't understand what's going on, consider palliative care for another voice to help for perspective and kind of tying all things together, like we mentioned about for communication or education, or even simply if you and your family just need support. Maybe there's times when I see patients and families when they say, yep, we know what the diagnosis is, we know what the treatment is, but we just need someone else just to talk to us. We need someone just to hold our hand. And oftentimes that can be just as healing as starting another medication, knowing that someone just coming alongside to say, I'll walk with you and just tell me how you're doing and we can do this together.
And how would somebody access this care?
Great question. It is a specialty service, so please feel free to talk to your primary care doctor, your specialist, and simply ask, is there a palliative care team that I can talk to?
Dr. Flynn, thank you for joining us once again. It's been just really nice talking to you and you teaching me a bunch of stuff. Are there any last thoughts for people who are just really unsure still?
Well, thank you. Again, I've appreciated being here. You're very kind and gracious. And yes, final thoughts. Yes, I'd say that choosing palliative care is choosing to live well. Even when you're facing the scariness of a serious illness or a disease. It's about prioritizing comfort, clarity, and connection. And it doesn't mean you're out of options. It just means that you're saying, I want to embrace another type of support, and I want another person in my corner to help me through this.
Dr. Flynn, thank you very much for discussing palliative care with us. And to our listeners, if you or a loved one are in need of palliative care, visit vitruvianhealth.com/specialty care or call 706-529-3072. That's 706-529-3072.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.